Hello everyone, this is Dr. A with ABF Healthcare Services. First, let me say how truly grateful I am for the overwhelming feedback we've been receiving on these health segments. Your support, your questions, and your engagement means the world to us. Please keep liking, sharing, and subscribing to our content. It helps us continue to bring you valuable healthcare information. Today, I'm answering a couple of questions we've received about hemophilia. What it is, how it's inherited, what the symptoms are, and what treatments are available. Well, hemophilia is a rare genetic disorder that affects the blood's ability to clot properly. Normally, when we get a cut or an injury, clotting factors in our blood work together to form a stable clot and stop the bleeding. In hemophilia, one or more of these clotting factors are missing and they're not working as they should. Most commonly, hemophilia is inherited through the X chromosome, which that means that it's passed down from the parents to the children. Because men only have one X chromosome, they are more likely to be affected if that chromosome carries the hemophilia gene. But women, on the other hand, they have two X chromosomes. So even if one has the gene, the other often compensates, making them a carrier who can pass the gene on to their children. The symptoms can vary. It depends on the severity of the condition. Some common signs usually include frequent nosebleeds. Sometimes they have prolonged bleeding from the cuts, and sometimes they're really easy to bruise. Sometimes they have very excessive bleeding after surgery, dental work, or either an injury. They definitely have a lot of joint pain, a lot of swelling, and that's usually caused by the internal bleeding into the joints. Severe cases, dangerous internal bleeding that can occur without obvious cause, that's when it's really serious. The symptoms usually appear early in childhood, but some mild cases may not be diagnosed until later in life. While hemophilia cannot be cured, unfortunately, but it can be managed very effectively. Treatment often involves replacement therapy, where the missing clotting factor is injected into the bloodstream to help prevent or control those bleeding episodes. Advances in medicine now also include the non-factor therapies, and they help regulate the clotting in different ways, giving patients more flexibility. Usually that causes fewer complications. It's also important for patients to adopt preventative health practices. That means avoiding high-risk injuries, getting routine care, and working very closely with the healthcare providers to create a personalized treatment plan to keep them healthy. Well, I hope this gives you a clear picture of what hemophilia is, how it's developed, and how it can be managed. As always, if you need more information or guidance or want to know a little more about another diagnosis, please don't hesitate to give us a call here at ABF Healthcare Services at 910-321-6006. We truly appreciate all of you who continue to follow our content. Please keep sending your questions, keep subscribing, and keep sharing. And remember, stay tuned for specials we may be running. The holiday season is right around the corner, and the best gift you can give yourself and your loved ones is the gift of good health practices with ABF Healthcare Services. Stay healthy, stay hopeful, and remember, your health is the greatest investment. This is your doctor, Dr. A, wishing you a safe and healthy season ahead.